Hi, I'm Mr. Gomez. I'm going to be performing skill number 9, dressing the patient with right side weakness. Okay, I'll knock on the door, wash my hands, come into the room. Hey, Mrs. Ethel, how you doing? I'm gonna check ID, make sure this is Mrs. Ethel. That is Mrs. Ethel. Okay, that's good. After I do that, I'm gonna go ahead and raise the bed. It's okay if I dress you, right, Miss Ethel? Yes. I'm gonna go ahead and provide privacy. After I do that, I will go ahead and grab my barrier. My barrier will go on the bedside table. I have my other supplies here. I have a bath blanket, 2 pairs of clothes, a gown and a shirt. I would come here and then I would say, hey, Mrs. Ethel, what shirt would you like to use today? I have a gown and a shirt. Which one would you like? The gown? Okay, that's good, thank you. All right, so I'm gonna go ahead and grab the bath blanket, and I would be putting the bath blanket on Miss Ethel to keep privacy and not expose. Make sure you do not shake the bath blanket. So it's very important that you do not shake it, and always put the stitching up, and the tag should go away from the skin. And just go ahead and cover Miss Ethel. I would bring down the covers from underneath. Without exposing Mrs. Ethel. Very important not to expose. Okay. Okay, I'm gonna come this way. All right. So now I will be undressing the strong arm. So just remember DWA, dress weak arm, and undress strong arm, USA. Okay, so the right is the weak side. So just remember that we always say either weak side or involved side. So I'm gonna go ahead and undress the left side actually. So undress the strong arm. So I'm gonna come this side over here. And I will be making sure that I unfasten the bow tie. Underneath, I will be grabbing the gown, making sure you do not expose Miss Ethel. It is very important not to expose Miss Ethel. Come over here. Okay, I'm gonna go to the other side now and then remove the rest of the gown. Away from my body, grab the gown, put that in the dirty linen, grab the clean gown, and I will put this over Miss Ethel. Again, do not shake the gown. It is very important not to shake the gown. You do not want to spread any of the microbes. So I'm grabbing this, putting the gown over Mrs. Ethel. And now I will be dressing the weak side first, which is the right side. I'll put my hand through the sleeve, grab Mrs. Ethel's hand, pull it, bring it down. Now I will go to that side. Put my hand through the sleeve again. All right, Miss Ethel, grab my hand, pull it down. Okay, very important not to expose Miss Ethel. So you want to bring down the bath blanket and not expose Miss Ethel, which is very important not to expose Miss Ethel. And no gloves are used for this skill, just to let everybody know. All right, I grab the bath blanket away from my body. I will go ahead and put it on top of my barrier. Grab the barrier with all the linen away from the body, and then I would put this in the dirty hamper with the dirty linen. Okay, so now we'll go ahead and come back over here. Undo privacy. Grab the colite, put it within reach. Lower the bed. Wash my hands, report and record, and now I completed skill number 9.